Hello! Today we are going to be talking about chronic obstructive pulmonary disease, or COPD. This presentation has been brought to you by Breathe California of the Bay Area. I'm going to begin by explaining what COPD is and how it affects the body. Then I will explain common symptoms of COPD and major risk factors associated with this disease. Finally, I will elaborate on current treatments and resources available to you or any loved ones you may know with COPD. Before I begin, here are some details about Breathe California of the Bay Area. Our local agency is based in San Jose, and we have been the clean air and healthy lungs leaders in the Bay Area since 1911. Our mission is to fight lung disease in all its forms and work with our community to protect lung health. We offer a host of services to protect lung health, and if you are interested in learning more about any of these, I've included our contact information at the end of this presentation, and we'd be happy to hear from you. So let's get started. COPD stands for Chronic Obstructive Pulmonary Disease, which is a general term referring to a group of serious diseases that cause airflow blockage and breathing-related problems. Emphysema and chronic bronchitis are common forms of COPD. Someone with COPD may actually have elements of multiple lung diseases acting on their body at once, which is why we prefer the general term COPD. This disease is preventable if you take certain precautionary measures to care for your lungs throughout your life. Because COPD progresses slowly over time, it usually takes many years for the lung damage to start causing symptoms, which explains why COPD is most common in people who are older than 60. You may be at a greater risk to get COPD if you had a lot of serious lung infections when you were a child. People who get emphysema in their 30s or 40s may have a disorder that runs in the family, called alpha-1 antitrypsin deficiency, but this is rare. Although there is no cure for COPD, there are many effective ways to treat and help manage the disease. Through medications, oxygen therapy, pulmonary rehabilitation, and social support, many people are able to live with their disease for many years. COPD makes breathing difficult for the 15.7 million Americans who have this disease. Millions more suffer from COPD, but have not been diagnosed and are not being treated. Notably, about 80% of patients with COPD in the United States have a history of cigarette smoking. This disease is ranked as the fourth most common cause of death in the United States, killing more than 120,000 individuals each year. That's one death every 4 minutes. You may be curious what those other leading killers are. They are heart disease, cancer, and strokes. COPD is also a leading cause of disability. When severe, it interferes with your ability to do everyday things like take a shower or tie your shoes. However, early on, the signs may be very subtle, and many people might think they are just out of shape or are just getting older. They may make small changes in their lives to accommodate these changes, like taking the elevator instead of the stairs, giving up a sport, carrying fewer bags at one time, none of which address the COPD they are experiencing. To understand COPD, it helps to understand how the lungs work. Looking at the diagram on this slide, we can see that the air you breathe goes down your windpipe into tubes in your lungs called bronchial tubes, or airways. Within the lungs, your bronchial tubes branch many times into thousands of smaller, thinner tubes called bronchioles. These tubes end in bunches of tiny round air sacs called alveoli. Oxygen from the air you breathe passes through these air sacs into the bloodstream. Healthy airways and air sacs in the lungs are elastic. They try to bounce back to their original shape after being stretched or filled with air, the way a new rubber band or balloon does. This elastic quality helps retain the normal structure of the lungs and helps move air quickly in and out. In people with COPD, the air sacs no longer bounce back to their original shape. They become floppy and not as elastic. Picture a bag made of cellophane compared to a rubber balloon. The cellophane airways, those without support, collapse, blocking the airflow out of the lungs. The harder the person tries to breathe out, the more the airways collapse. The airways can also become swollen or thicker than normal, and lined with mucus. The symptoms of COPD may be subtle at first, often including a chronic or nagging cough, also known as smoker's cough. This might be dry, or you might have mucus or phlegm that's clear, white, yellow, or green. Other symptoms include shortness of breath while doing activities you used to be able to do, as well as feeling like you can't breathe or take a deep breath, and wheezing. These symptoms can get in the way of basic day-to-day tasks, from doing housework to taking a walk or even bathing and getting dressed. If you recognize any of these symptoms, no matter how mild you think they are, talk with your doctor as soon as possible. Chronic cough and phlegm are not normal, and their presence should trigger a search for an underlying cause. As the disease progresses, the symptoms of COPD usually worsen. Some people may experience blue or gray lips and/or fingernails, which is a result of decreased oxygen delivered to the body. They may also experience trouble with mental alertness, concentration, a fast heartbeat, swelling in the feet and ankles, weight loss, as well as sleep problems. These next few slides clarify important distinctions between asthma and COPD, which are not the same. Asthma is caused by inflamed airways and causes the muscles around the airways to tighten. Asthma is most often diagnosed during childhood. COPD, on the other hand, is the result of excessive mucus and inflammation, which block airways and tissues break down. COPD tends to develop in people over the age of 40. Smoking is the biggest contributor to the development of COPD, whereas the exact causes of asthma are unknown. Asthma severity can remain steady or get better throughout a person's lifetime, whereas COPD is a progressive disease, meaning it worsens over time. Some of the symptoms of asthma and COPD are the same, for example, wheezing, chest tightness, and shortness of breath. And some people may have both conditions at the same time. Now we are going to discuss the major risk factors for this disease. COPD is usually caused by many years of exposure to irritating gases or particulate matter, most often from cigarette smoke. Smoking accounts for almost 9 out of 10 of the COPD-related deaths. When a cigarette burns, it creates more than 7,000 chemicals, which, when ingested for prolonged periods of time, weaken the lungs' defense against infections, narrow air passages, and cause swelling in air tubes and destroy air sacs. That being said, it is also important to note that as many as 1 out of the 6 people with COPD have never smoked in their life. Long-term exposure to air pollution, secondhand smoke, and dust, fumes, and chemicals, which are often work-related, can cause COPD. Secondhand smoke also may damage the lungs. It is important to stay away from secondhand smoke if you do not smoke. In some people, COPD is caused by a genetic condition known as alpha-1 antitrypsin, or AAT, deficiency. People with AAT deficiency can get COPD even if they have never smoked or had long-term exposure to harmful pollutants. If you don't treat your asthma, lung damage over time can also lead to COPD. The test to diagnose COPD is simple, quick, non-intrusive, and painless. Asking your doctor for a COPD test could potentially help prolong your life by years, as well as allow you to enjoy countless more activities in your day-to-day life. If your doctor determines that you have COPD, they may recommend any one or a combination of the following treatments. The biggest lifestyle change doctors will suggest is to quit smoking. If you smoke, now is the time to stop. It is never too late to stop smoking. While your lungs will not regrow, you can prevent further damage They may also suggest medication, including bronchodilators and steroids, which help open the airways. They may suggest pulmonary rehabilitation, which is a program that teaches you how to manage your disease and how to go about regular activities a little more easily. Your doctor may also recommend physical activity training. This may teach you some activities to help your arms and legs get stronger, and/or breathing exercises that strengthen the muscles needed for breathing. Support groups are also a great treatment strategy. There are many COPD support groups offered at local hospitals, and there's a very active COPD community online to help create community and share stories or suggestions. In severe cases, oxygen treatment may make the person feel better and live longer. You may need oxygen all of the time or just some of the time. Your doctor will work with you to learn which treatment will be most helpful. Lung volume reduction surgery or lung transplant is usually the last resort for those with severe symptoms that have not improved from medication. Every patient is different. Work with your doctor to determine what works best for you. It is important to visit your doctor regularly. Be honest with your healthcare team about symptoms and concerns related to COPD. Follow the treatment instructions you've been given. Be sure to bring a list of all medications that you take to each doctor's visit. Ask your doctor about resources to help quit smoking. It is never too late to quit smoking. Breathe California of the Bay Area offers several tobacco cessation programs, and we also have self-help books available to help you quit. Furthermore, stay away from things that irritate your lungs, like dust, fumes, pollen, etc. Stay indoors when the air quality outside is poor. Also, stay away from places where there might be damaging cigarette smoke. It all begins with you. Be your own advocate. You deserve to live a long and happy life. Thank you so much for your time today. I hope you learned something about COPD. Please don't hesitate to contact us with any questions you may have about the presentation or about any of the services we offer here at Breathe California. Please click on this link below to take a quick 5-minute post-presentation survey about your experience with this presentation.